There are 147 new community cases of COVID-19 today, all in the North Island. The numbers come after the government announced sweeping changes to international border restrictions. The new cases are in Northland, 14, Auckland, 90, Waikato, 15, Lakes, 9, Bay of Plenty, 8, Hawke's Bay, 7, and the Wellington region, 4. There are also 44 new cases at the border. 13 people are in hospital with COVID-19, but none is in intensive care. Of those in hospital, 1 is in North Shore, 5 are at Middlemore, 2 are in Auckland, 3 are in Rotorua, 1 is in Hawke's Bay and 1 is in Wellington. Today's 44 new cases at the border came from Italy, Pakistan, Egypt, Singapore, Australia, India, USA, Fiji, UAE, Turkey, Saudi Arabia, Canada, Thailand, Qatar and Nepal. There have now been 16,630 cases of COVID-19 reported in New Zealand since the pandemic began. There are 14 new cases in Northland, across Kerikeri, Kaitaia and Wangarae. 9 are linked to existing cases and investigations are underway to determine links for 2 cases. 3 of the cases reside in Northland but were originally allocated as Auckland cases. The people are being transferred for management to the Northland Public Health Unit. Of these 3 cases, 2 are linked and 1 is yet to be connected to the outbreak. Meanwhile, there are 90 new community cases in Auckland as health and welfare providers helped 1,534 people in the region to isolate at home, including 568 cases. There are 15 new cases in Waikato and most so far have been linked to previously reported cases. In the Lakes DHB region, there are 9 new cases. 8 of those cases are in the Rotorua district and 1 is in the Hawke district. 1 case has not been linked to existing cases. There are 8 cases to report in the Bay of Plenty today, 5 are in Tauranga, 1 is in the Western Bay of Plenty and 2 are in the Eastern Bay of Plenty. 7 of the new Bay of Plenty cases are linked to existing cases and 1 is yet to be connected to the outbreak. In the Hawke's Bay, there are 7 new cases. 5 of these cases are linked to existing cases while the remaining 2 are yet to be connected to the outbreak. In the Wellington region, 2 new cases are in Wellington and 2 are in Rotorua. 3 are linked to existing cases and the 4th person's links are yet to be established. Holiday weekend advice. Those heading away for the Waitangi long weekend have been urged by the Ministry of Health to plan for the potential of having to self-isolate or to stay longer in paid accommodation than planned. You are likely to need to self-isolate wherever you become a close contact or test positive, so there may be extra costs involved in paying for accommodation and changing your travel plans, the ministry said in a statement. There are limited alternative accommodation options for those who are unable to safely isolate in their own homes or if they have traveled elsewhere, and as case numbers rise, the accommodation will be focused on those with high needs. Anyone with any COVID-19 symptoms should not travel and should get tested and isolate until they get a negative result back, the ministry said. The most common early symptoms of Omicron were a sore or scratchy throat and a runny nose. All travelers should wear a mask in indoor settings, physical distance, and scan in using the NZ COVID Tracer app, the ministry said. Positive case at hospital. This morning Capital and Coast District Health Board confirmed that a person tested positive for COVID-19 at Wellington Regional Hospital yesterday. The person had turned up at the hospital for an issue not related to COVID but was tested because they had symptoms. They were now isolating on a ward set up to manage COVID-19 patients and investigations were underway to determine the source of their infection, the health board said. Border plan. Ahead of today's update on case numbers, the government announced it was reopening the border starting with Kiwis coming from Australia from the end of the month. In a speech to Business NZ in Auckland this morning, Prime Minister Jacinda Ardern outlined the 5-stage process of reopening the borders. It also came on the same day changes to the mask-wearing protocol come into effect from 11:59 p.m. tonight. The changes were announced 9 days ago by Ardern at a press conference and they affect those visiting food and drink businesses and other close proximity settings, as well as some primary and secondary students and workplaces with vaccine mandates in place. On the new mask rules, Ardern said they would further help the slowdown of Omicron. One of the new rules is that a face mask now needs to be an actual mask, meaning a covering that is attached to the head by loops around the ears or head. Scarves, bandanas and even t-shirts no longer suffice. Within just a month of the first community exposure to Omicron in New Zealand, the variant has already become the dominant strain of COVID-19. New modelling predicted that New Zealand could hit 400 daily cases by the end of the week. Additional reporting RNZ.